Depression is not a weakness or something easy to get rid of it, known as acute depressive disorder, severe depression disorder, or clinical depression, clinical depression. It is a disease that affects the soul and the body. Depression affects the way you think and act and can lead to many emotional and physical problems. Usually, people with depression cannot continue to practice their daily lives as normal, as depression causes them to feel a lack of desire in life. It should be noted that depression is one of the most common diseases in the world. Dealing with depression. Today, the majority of workers in the field of health deals with depression as a chronic disease. Treatment requires a long-term, exactly as they are dealing with diabetes, or with hypertension. Some people with depression experience only one period of depression, but in most patients, symptoms of depression recur and last a lifetime. Through proper diagnosis and treatment, symptoms of depression can be reduced, even if the symptoms of depression are severe. Proper treatment can improve the feeling of people with depression within a few weeks, usually, and enable them to return to their normal lives as they used to enjoy before depression. Symptoms of depression. Number 1, loss of desire to perform regular daily activities. Number 2, feeling nervous and depressed. Number 3, feeling of hopelessness. Number 4, bouts of crying for no apparent reason. Number 5, sleep disturbances. Number 6, difficulty focusing. Number 7, difficulties in making decisions. Number 8, accidentally gain or lose weight. Number 9, nervous. Number 10, worried and restless. Number 11, excessive sensitivity. Number 12, feeling tired or weak. Number 13, feeling undervalued. Number 14, loss of desire for sex. Number 15, suicidal thoughts or suicide attempts. Number 16, unexplained physical problems, such as back or head pain. The symptoms of depression are different and varied because depression appears in different forms for different people. For example, symptoms of depression may appear in a 25-year-old person with depression that is different from that in a 70-year-old. Some people with depression may have very severe symptoms that indicate that something is not right. Others may feel that they are poor in general, or that they are not happy, without knowing a reason for this. Causes and risk factors for depression. It is not known, yet, the exact cause of depression. The prevailing belief, as is the case with other psychological diseases, is that many genetic, environmental, and biochemical factors can be the cause of depression, including, number 1, biochemical factors. Research that uses imaging using modern and advanced techniques confirms physical changes in the brains of people with depression. It is not known exactly yet what these changes are and their degree of importance, but clarification of this matter will ultimately help define and identify the causes of depression. It is possible that the chemicals present in the human brain naturally, called neurotransmitters, and related to mood, play a role in causing depression. An imbalance of the hormonal balance in the body would also cause depression. Number 2, genetic factors. Some research indicates that the onset of depression is more prevalent in people with biological relatives with depression. Researchers are still trying to find the genes involved in causing depression. Number 3, environmental factors. The environment is considered, in a certain degree, as a cause of depression. Environmental factors are situations and conditions in life that are difficult to face and coexist with, such as the loss of a loved one, economic problems and acute stress. It is true that there are no accurate statistical data, but depression is a very widespread disease. Depression transcends all boundaries and differences, racial, ethnic, and socioeconomic. No one is immune to depression. Generally, depression begins in the late 20 years of age, but depression may appear at any age and may affect anyone, from young children to the elderly adults. The number of women diagnosed with depression is twice that of men. This may be partly due to the fact that women are more likely to seek treatment for depression. The most important causes that lead to depression. The exact cause of depression is not known, but research indicates several factors that seem to increase the risk of developing depression, or cause it to worsen, including: Number 1, presence of biological relatives with depression. Number 2, suicide cases in the family. Number 3, life-threatening events, such as the death of a loved one. Number 4, depressive mood in the morning. Number 5. Diseases, such as cancer, heart disease, Alzheimer's or AIDS. Number 6. Long-term continuous consumption of certain medications, such as certain types of blood pressure medication, sleeping pills and birth control pills in some cases.